Hey, we're tackling the scapula. You probably know it as a shoulder blade. We've got some pretty dense anatomy notes here, but our goal is, well, to pull out the really key stuff about this essential bone.
Absolutely. And, the big thing to grasp right away is its job. The scapula is basically the bridge.
A bridge.
Yeah, it connects your whole arm, your upper limb to your main body, the axial skeleton. Think spine and ribs. It's the crucial link.
Okay, got it. So where exactly is this thing sitting? On our back, obviously. But
Right. Posterolateral thorax is the term. So the back and slightly to the side of your chest cavity. It usually covers ribs 2 down to 7.
okay.
But here's the kicker, the really interesting bit from the notes. It doesn't lie flat, not at all. It's actually angled.
Angled how?
Obliquely. It sits at about a 30, maybe even 45-degree angle compared to just straight up and down.
Whoa, 30 to 45 degrees. Okay, that straight away tells you it's built for more than just sitting there. That implies movement, like dynamic action.
Exactly. Think throwing, reaching. That angle is key.
So our sources mention two main surfaces. There's a costal one facing the ribs and a dorsal one. The backside we can sort of feel.
Correct. And that dorsal surface, the back one, it's dominated by this huge ridge, runs right across it. That's the spine of the scapula.
Like a dividing line.
Precisely. Think of it like a big bony shelf dividing the back surface.
And this spine is important because it creates these hollows, places for muscles.
Exactly. Fossa. Above the spine, you get the supraspinous fossa. That's where the supraspinatus muscle starts.
Okay.
And below it, the larger infraspinous fossa for the infraspinatus muscle. So key rotator cuff muscles originate right there.
Anchors for moving the arm up. And if you follow that spine outwards towards the shoulder tip.
That's where it flares out and becomes the acromion, that bony point you can feel right at the very top and back of your shoulder.
Right, okay. Let's flip it over mentally. The front side, the costal surface facing the ribs.
Yep, the anterior side, it's concave, kind of scooped out. This whole scooped out area is the subscapular fossa.
And that's for another big muscle.
A huge one. The subscapularis, it fills that whole front surface. It's a powerful internal rotator, lets you reach behind your back.
Okay, surfaces covered. Now the edges, the borders. Our notes say this is where a lot of the action happens, attachments and leverage. Let's start with the medial border, the one closest to the spine.
Right, the vertebral border. Think stabilization here. This edge is where muscles like the levator scapulae and the rhomboids minor and major attach.
What do they do?
They basically pull the shoulder blade towards the spine, keeping it snug against your back.
Yeah.
Stops it from winging out when you push or carry things like guy wires holding it steady.
Makes sense. Then opposite that, on the outside edge, under the armpit.
That's the lateral border or axillary border. And you'll notice it's much thicker, much stronger than the medial one.
Suggesting more power.
Definitely. This thick edge is packed with muscle origins. You've got talus minor, talus major, even the long head of the triceps starting here.
Wow, okay.
This is a real power zone for pulling the arm down and back and rotating it.
All right, one border left, the top one. The superior border. Looks shorter in the diagrams.
It is shorter, yeah. But it has a really specific, important feature. The suprascapular notch. It's like a little cutout.
A notch,
Well,
wait.
it's a passageway. The suprascapular nerve runs through it. This nerve is vital for those supraspinatus and infraspinatus muscles we mentioned earlier.
Ah, so the notch protects the nerve as it passes by the bone.
Exactly. Ensures it doesn't get pinched or damaged when you're moving your shoulder around. Smart design.
So putting it all together, the surfaces, these three borders, the angles, what's the big picture?
Well, it's clear the scapula isn't just some passive flat bone. It's a really complex three-dimensional structure. 3 borders, 3 angles, 2 surfaces, all shaped and angled specifically.
More like a dynamic platform than a shield.
Absolutely. Its whole structure screams movement, adaptability. It's built for this incredible range of motion the human shoulder has, reaching, throwing, pulling. That angled position is central to all of it.
Okay, so reflecting on all this, we know it covers ribs 2 to 7, connects the arm. Here's something for you, the listener, to chew on. How does that specific 30 to 45 degree slant actually affect how efficiently you can move your arm, especially reaching overhead or throwing.
Right. Imagine if it was flat against your back. How would that change things?
Something to think about next time you reach for that top shelf.